If you're new to Medicare, you've probably received many flyers, emails, and maybe even phone calls. But where to start? Well, we're going to go over the 4 things that you absolutely must do if you're starting Medicare. Hi there. As always, if you have any questions whatsoever, please feel free to reach us at the number on the screen, and you can send us a message in the comments below. Now, before we get too far into today's video, a friendly reminder, please make sure to subscribe to stay up to date, not just at the beginning of your Medicare journey, but as you go on. And of course, make sure to like this video so that we can get this information out there. All right, let's dive in. Now, if you're just starting Medicare, you may or may not have heard of Medicare Advantage. Medicare Advantage plans are sometimes referred to as Part C or managed care plans, and they're actually a replacement for original Medicare. So that means you cannot have original Medicare and a Medicare Advantage plan together. And there are pros and cons that you should be aware of. So first, Medicare Advantage plans are often less expensive than original Medicare plus a Medigap plan, so you'll very often have lower monthly premiums. Also, very often Medicare Advantage plans offer additional benefits, things like dental, vision, hearing, and prescription drug, and these are not available with original Medicare. Finally, Medicare Advantage plans offer special needs plans. These would be things like DSNPs and CSNPs. So DSNPs are dual eligibility special needs plans, which are Medicare Advantage plans offered to people who are eligible for Medicare and Medicaid. They can be a great cost-saving way to have access to additional benefits. And then there are CSNPs, which are chronic illness special needs plans, and these are tailored for people who have certain chronic illnesses. Then there are the cons. So, Medicare Advantage plans have restrictive networks. With original Medicare, you can see any doctor and visit any hospital that accepts original Medicare, and almost all do. And it's the same for your supplement plans. With Medicare Advantage plans, you need to operate within a network, and this can be very restrictive, far more restrictive than many people think. And also, another major con is that you may need pre-authorization. So not only does your doctor have to give you a referral for a certain procedure or specialist, but your insurance plan has to approve it as well. Now, very often when people talk about Medicare Advantage plans, they compare them to Medigap plans, and the two really are entirely different. And in all honesty, Medicare supplement plans are far more popular, and we are going to talk about that later in the video. But if you do enroll in a Medicare Advantage plan and you change your mind, there are several ways in which you can leave your plan. For example, during the MAOEP or during your first year during that trial period. We've got a video dedicated to that, which I will put in the description below. But yes, do remember that if Medicare Advantage doesn't end up working out for you, you may be able to get out of your plan and into a plan that's better suited to your needs. And remember, Medicare Advantage plans can change quite drastically from year to year, so always make sure that you review your plan as well as any additional options that there may be during the AEP, which is every year from October 15th to December 7th. Now, another thing that you absolutely must do when you're starting Medicare is either enroll or possibly defer. And there are different enrollment periods that you want to be aware of. So first, let's talk about original Medicare. Now, with original Medicare, you'll likely be automatically enrolled. This initial enrollment period is the 7th month surrounding your 65th birthday. So that's the 3 months before you turn 65, the month of your birthday, and the 3 months thereafter. You'll likely receive your card in the mail, but if you don't, make sure to contact Social Security. Now, you may also want to defer Medicare, specifically Medicare Part B, because for everyone there actually is a premium for Medicare Part B, although most people don't pay for Medicare Part A. And if you are maintaining creditable coverage, specifically if you are perhaps working past the age of 65 and getting insurance through your employer, there's absolutely no need to pay twice. So if you do wish to defer Medicare Part B, make sure that you follow the instructions on the back of the card and send it back. Because if you keep the card, you're going to keep Medicare Part B and you're going to be charged for it. Now, if you are choosing to enroll in a Medicare Advantage plan or even supplement your original Medicare coverage with a Part D plan, then there are enrollment periods that you need to be aware of as well. Now, of course, you can enroll when you first become eligible, so that's that same 7-month window. And you can also enroll during the AEP, which, as I mentioned just a moment ago, is October 15th to December 7th. One final reminder, there are late penalties for Medicare Part B and Medicare Part D. So make sure that you're maintaining creditable coverage, otherwise you may be subject to a late penalty. And then there are Medicare supplement plans. These are also known as Medigap plans. And you can actually enroll in a Medicare supplement plan year-round. There's no specific enrollment period. However, it's in your benefit to enroll in a Medicare supplement plan when you first become eligible. So in the 6-month period after you turn 65 and enroll in Medicare Part B, you won't be subject to medical underwriting for a Medicare supplement plan. Should you choose to enroll outside of the 6-month window, then you may be subject to medical underwriting, which means you could be charged more or possibly even denied outright. So that's why we recommend that you decide sooner rather than later if you'd like to enroll in a Medicare supplement plan. Now, unlike Medicare Advantage plans, Medicare supplement plans work in conjunction with Original Medicare. So they're going to fill in those financial gaps of Original Medicare, namely copays, coinsurance, and deductibles. Also, unlike Medicare Advantage plans, if your doctor accepts Original Medicare, they accept your supplement plan. So they offer tremendous freedom and flexibility, and really that's why they're so popular. And there are 10 plans to choose from with varying levels of coverage. So of course we recommend that one of the first things you do is figure out what level of coverage you need to determine which plan is best for you. And if you're just starting Medicare, one of the other important things that you definitely want to look into is Medicare Part D. Medicare Part D are strictly prescription drug plans. So yes, many Medicare Advantage plans do offer some type of prescription drug, but Original Medicare and Medicare supplement plans do not offer prescription drugs. So you would need a separate plan to cover these. Now, this is definitely something that you want to start looking into right away, especially because there is a Part D late penalty. Now, as brokers, of course, we recommend that you never go without some type of creditable coverage. However, in all honesty, the penalty for Medicare Part D is nowhere near as significant as the penalty for Medicare Part B. So if you do end up having a small few-month coverage lapse, it's probably not the end of the world. Like Medicare Part C and Original Medicare, you can first enroll when you first become eligible, that same 7-month window, 3 months before your 65th birthday, the month of, and the 3 months thereafter, or during the AEP, October 15th to December 7th. Now, even though you have a little wiggle room when it comes to Medicare Part D, it's still one of the first things we recommend you look into because, quite frankly, Medicare Part D is probably one of the most confusing parts of Medicare, so you definitely want to do a little bit of research before you dive in. And as a bonus, 5th thing we recommend if you are starting Medicare, we recommend that you make an appointment with a broker, especially if your initial enrollment window is anywhere near the AEP, because many brokers book up way in advance. Now, you will not pay more by working with a broker. Your premium isn't going to change. Although some brokers do charge a one-time fee, many don't. The benefit here is that you have a real person to speak to that you can ask any of your Medicare-related questions to. And of course, a broker works for you, not the insurance carrier. So they can help you compare multiple different plans offered by multiple different carriers to ensure that not only are you making the best use of your time, but that you're getting the best plan for your needs. So as I mentioned, many brokers do not charge for their services, and of course, we don't charge for our services. So if you'd like our help, you can reach us at the number on the screen, and you can always reach us with any comments or questions in the comments below. Now please, before you go, do make sure to click that subscribe button, and of course, click that like, give us a thumbs up so we can get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.